Continue to try and get answers to the questions that everyone has during this coronavirus pandemic. This afternoon, St. Louis County Executive Dr. Sam Page joins us live from the county's Emergency Operations Center in Ballwin to hopefully answer some of the questions that you might have. Dr. Page, thank you for your time this afternoon. We know that you are working around the clock, and we appreciate you doing this for us. We'll start off with the big headline today. Our Kim St. Ange was outside of the non-hospital site you now have set up in North St. Louis County. Next Monday, you will be taking patients in this area. Talk about why we need these locations, and will we be seeing more of them?
Well, I think we all look and see what's happening across the country, and we listen to our public health policy experts, and we know that our hospital systems in St. Louis County are going to be stressed. They're going to be stressed in the entire region. We've taken some assertive measures to limit crowd sizes and to encourage social distancing to try and blunt the curve of the impact of patients in our hospital systems. But we know that we should expect an influx in the next 2 or 3 weeks, and we're getting prepared to that. We're working closely with our regional elected officials, our public health experts, and our hospital system leadership.
When and where would we see more of these non-hospital sites for COVID-19 patients?
Well, we're just talking about that today. I just stepped off of a conference call with the Army Corps of Engineers. The state is now talking about their plan. They have an emergency operations plan that they're talking about implementing that will be in cooperation with the Missouri Hospital Association. But I believe in the next day or two we'll have more announcements. There are certainly large structures around our community that could be used for temporary hospitals, such as America's Center or Chaifetz Arena, the Dome, the St. Charles Family Arena. These are all possibilities. There are no firm plans. These are just discussions. What we do know is that we want to be prepared. We want to be prepared for the real challenges and make sure we're ready for what we expect. Regardless of what happens, we know our community will be challenged. We've been challenged in the past as a community, as a country. We are a very resilient people, and we're going to find a path forward.
As you talk about the influx we perhaps will see in the next 2 weeks, we look at the numbers here in St. Louis County. We continue to have the highest number of positive cases in the state. We're estimating the county to be about, say, 16% of the state population, but right now we have about 37% of COVID-19 cases. Does that not concern you?
Well, absolutely. We are the largest jurisdiction in the state. We certainly have a lot of individuals who were traveling over December and January. We know that that's how the virus reaches a community, and we would expect that we would see those cases move around in St. Louis County, and we would have that spread. We're reacting appropriately to try and limit the spread. That's why social distancing and these stay-at-home orders are so important. We know that if we can eliminate social mixing and keep people from coming into contact with each other unless it's absolutely essential, we can stop the spread of the virus in our community.
All right, Dr. Page, so much more we could talk about, so here's what we're going to do. We're going to take a quick break. We'll be back right with you in just about 3 minutes with St. Louis County Executive Sam Page. So stay with us. We will be right back.